Turning now to Health Watch tonight. Despite the global pandemic, those battling illnesses, they still need to continue their treatment. In today's Health Watch, Local 5's Connie Fellman shares the story of a local woman who received a devastating diagnosis right before everything shut down.
Many of us have heard that cancer doesn't discriminate. Turns out, doesn't much care if there's a global health crisis going on either. But when a Green Bay woman heard the words, "You have a brain tumor," time was of the essence, pandemic or no pandemic. Julie Molzon loves spending time with her grandchildren.
I just enjoy family and grandchildren right now.
In fact, she says living in the moment is what matters most to her right now.
I do have stage 4 cancer, so I don't really know what the future holds.
That's right. You wouldn't know it by looking at her, but this vibrant gardening grandma is battling stage 4 cancer.
Yeah, I've kind of just accepted that.
What began as a nondescript bump on her neck ultimately ended up as a tumor in her brain.
Approximately 2 years ago, I noticed a lump on the side of my neck. And once it was biopsied, we found out that I had melanoma.
Julie underwent surgery, radiation, and chemotherapy, which took care of the melanoma. But last February, Julie started having headaches.
We found out that it had come back, and I had a tumor then in the brain.
Not only had the cancer come back, but this time in a much tougher place to treat.
About 2 inches below the surface of the brain. So it's kind of deep in the brain.
That's where Dr. Max Otts and his team at Aurora BayCare Medical Center came in.
One has grown there, and if you don't do something about it, it's going to cause significant brain damage.
Time was of the essence.
I got to see him very quickly. Everything was in a very timely manner, which I really appreciated because it was right before everything shut down for COVID.
Dr. Otts used a cutting-edge technology called BrainPath.
That allows us to go through the brain and displace the brain tissue and the brain fibers to cause as little damage as possible.
Even at the height of a pandemic, Julie says she felt completely comfortable seeing her medical team.
All of the personal protection equipment that they use, everything is social distanced in the waiting rooms. I see people going through sanitizing the chairs in the waiting room.
Dr. Otts says putting patients at ease is a priority at Aurora BayCare.
Obviously, it's very difficult times for patients, and we need to make sure we take care of them.
As far as Julie's concerned, mission accomplished.
I was very happy working with him and his team.
Julie was the first patient at Aurora BayCare to use the new BrainPath technology, giving her more quality time with those grandchildren. And that's your Health Watch. I'm Connie Fellman, Local 5 News.